Happy Monday. Here's two tips to avoid burnout in your clinic if you are trying to scale and you're stressing out along the process. Two tips. Number one, I had an email recently from a buddy of mine who's burning out, who's stressing out. And a lot of the underpinning as to why he's stressing out is because he's carrying the weight of the clinical results and satisfaction of his patients on his shoulders. And when I mean by clinical results is pain reduction, disease management, and all of the allopathic indicators that come along with it. If you are a chiropractor, you should have chiropractic indicators, and your responsibility to your patient and to your community is the chiropractic stuff. Right? The allopathic stuff, there is a profession to handle that. It's called medicine. And chiropractors fought for a good many years to stay out of prison on the basis that what we do is not a substitute or the practice of medicine. And it's okay and needed to be a separate and distinct provider in the healthcare marketplace. We do not have to be the disease management model. That's already out there. It's called medicine. And so one of the ways to avoid burnout is to stand firmly in your piece of the healthcare pie. And one of the things that Dr. Brooks said, a mentor of mine, he said, there are some things that are directly related to the spine. There are some things that are indirectly related to the spine. And there are some things that aren't related to the spine at all. And that's okay. And over the course of care, you and your patients will be able to determine which issues are directly related to their spinal misalignment and subluxation and which are indirectly related and which are not related at all. And that's one of the ways to avoid burnout is to stand firmly and with great satisfaction and provide fantastic results on the piece of the healthcare pie that you own. And when you try to own other pieces, that's when you start to burn out, you start to fatigue, and you start to carry a lot more stress than you're supposed to be carrying. So let go of that. Let go of that stress. Let go of that burden. It's not yours to carry. Number two, this is one of the first things I learned in practice, is that there's only 24 hours in a day, 7 days a week, and you have to take accountability for your schedule. And in your schedule, there should be times where you're working in your business, and there should be times when you're working on your business. It's really important because it's hard to be in your business when you're thinking about the overarching things, and it's hard to do the overarching things if you're getting dragged back into the business. And so you have to set aside in business hours and on business hours. You also have to set aside larger chunks of time when you're forecasting for larger periods of time. So things like quarterly meetings once every 90 days where you look at the big picture things, an annual strategic planning meeting. That's a whole weekend that you do once a year. And yes, at the time of this recording, registration is open for just a couple more days for latecomers to the annual strategic planning meeting that we host in Eastern Tennessee in the Smoky Mountains. It's gorgeous. You can check out drianbulo.com for all the information on that strat plan that we do every year for small business owners, especially in chiropractic. You have to spend the time. You have to allocate the time that is separate and outside of your clinical hours to work on your business. It's a surefire way to avoid burnout, to keep your mindset clear, make sure you're focused on the things that matter most. And two tips. Hope that helped. Enjoy the rest of your week. We'll see you guys around. Bye-bye.